Good morning. So I'm coming on live today to drink a little coffee and do a live Q&A. I love doing these because you guys have so many great questions. And so if you're just joining me, we're going to give me some likes, take your finger and tap my face as many times as you can stand like this. This will drive the algorithm. And if you have any questions, just drop them in the comment section down here below. So for those of you who don't know me, my name is Dr. Mary Claire Haver. I am board certified OB-GYN, but I have a special interest in menopause and menopause care. I have developed a menopause clinic where I just take care of menopausal ladies wherever they are in their journey, peri or post. And it has probably been the biggest impact on women's health I've ever made in my life. And listen, I've delivered thousands and thousands of babies. So, good morning, Beth. So everybody take your finger, tap my face as many times as you can stand with your finger. It drives the algorithm, and drop your questions, any menopause related women's health questions that you have, in the comments below. It helps drive the algorithm and keeps me relevant on this platform, which gets pretty hard. Okay, so we have 135 people on. So one of the most common questions that I get is defining the stages of menopause. And so many of you who are postmenopausal are like, what about me? So when I say menopausal, I mean anywhere in your menopause journey. Okay, so menopausal is a catch-all phrase. So it's peri through death, through post. Okay, once you're menopausal, you are menopausal for the rest of your life, And perimenopause represents the beginning of the noticeable decline of ovarian function. And that can take 7 to 10 years. So you go from normal, living your best life and no menopausal symptoms whatsoever, having monthly periods, if you have healthy ovaries, everything normal until something ain't right. And because there are at least 60 signs and symptoms of perimenopause and menopause, it's real, and they're not recognized by most medical. Well, they're getting there, but so many of them aren't recognized even by OB-GYNs. It can be a very horrible and confusing time for you because you go to your doctor, they do some tests, they tell you everything's normal, but you really are peri or postmenopausal. Okay, so let me get to your questions. One second, I'm going to flip the screen right here. Okay, so Stephanie asked, good morning. I'm 47. You've been postmenopausal for almost 5 years now. Wow. So you started really young. You were almost premature ovarian insufficiency. You're definitely premature menopause. So premature menopause happens before the age of 45. And premature ovarian insufficiency is before the age of 40. You lost your ovaries at a very young age. That puts you at a special risk category. The younger you are when you lose ovarian function, so full menopause, the higher your health risk for things like dementia, Alzheimer's, cardiovascular disease, obesity, etc. So, I can't change that for you. I can't change the fact that you lost your ovaries so young, but what I can do is educate you that you cannot take this for granted. And there are things that you can do to decrease your health risks as you get older. Good morning from Michigan. Janice, I'm on estrogel and the Marina now, and you feel so much better thanks to you. That is a wonderful, fabulous combination. I'm so glad the estrogel is working for you. That's fantastic. I love the Mirena for you, especially if you were having kind of horrible periods before. The Mirena can be a lot of help. And now that you have it in place, you have at least 8 years of progesterone in your uterus protecting that endometrial lining. So that's great. Karen, my friend Karin says Karen. So why do your hips hurt so bad? Okay. And guys, thank you for the likes. Again, driving this algorithm is everything. It just tap my face and give me likes. It helps, TikTok show people. Hang on. My phone's not charging. 1 second. I got to plug this in. Okay. Why do your hips hurt so bad? You're 2 years into menopause. Musculoskeletal pain affects about 80% of us guys in perimenopause and menopause. Who out there? Let me see in the comments. Let me see in the likes. Who out there has had unexplained? I'm not talking you twisted your ankle or anything. You woke up with unexplained joint muscle pain, either or encapsulitis, frozen shoulder, hip pain, back pain, joint pain, knee pain, without injury. 80% of us will experience this. Now, what can we do about it? That's the next step. What can we do about it? Guys, hormone replacement therapy helps, okay? The estrogen deprivation. Estrogen is a natural anti-inflammatory hormone. You take it away, we start flaring, okay? And so inflammation happens in the muscles and joints. So what can you do? All the things you already know: yoga, stretching, protecting your muscles. You must keep moving. You must keep trying to be strong. Don't let these injuries keep you from doing stuff. I mean, if it's an acute injury and you need to rest for a few days, yes, but on the days where you're achy. Now, HRT is helpful, but if you don't have access to it, I hate saying you can't take it, because 98% of you can take hormone replacement therapy. It is the rare woman who is an absolute contraindication, by the way. Okay. 98% of you are absolute candidates for hormone replacement therapy, depending on your age. So estrogen is better at prevention than at stopping things once they get started. So women who are started on hormone replacement therapy young, before they start having musculoskeletal pain, have a lower incidence of musculoskeletal joint pain due to menopause. Okay, but hormone replacement therapy can be helpful. Other things: turmeric. Turmeric actually has been shown to help with arthritic pain. Arthritis is another thing we see flare. That is joint pain. Okay. And so, yeah, I'll talk about hair loss too. So turmeric is really helpful. Omega-3 fatty acids are helpful. Moving your body, stretching, all helpful. Thanks to you and your info, my doctor prescribed me HRT. You're so welcome. You went in with your guns loaded, right? You stood your ground. You handed articles. Tell me what you did, Charm, to advocate for yourself, because on my website at galvestondiet.com, if you go to the blogs, I have an entire blog, and it's actually in the link in bio, how to advocate for yourself for hormone replacement therapy. I have the articles to print out and hand to the healthcare provider. I'm serious. Okay. I can't be your doctor unless you come see me in Texas or Colorado, but I can teach you how to advocate for yourself, so at least you have a shot. Okay. All right. Keep tapping my face, guys. It really helps. Right. And if you don't follow me, please follow me. The algorithm is tough here on TikTok, and my videos are dropping off. I don't look at it as I've pissed some people off on this app proudly, and they report you. So it really causes the algorithm to stop showing your videos. Thank you for the heart, guys. Thank you. Thank you. Thank you. And that's okay. My job is to dispel misinformation, to dismantle the patriarchy, at least as far as I can in relation to menopause and medicine, and to make sure, there's a vacuum in menopause care, a vacuum, and it's created space for these charlatans to get out there and convince you that, convince you that you don't need hormones and you don't need this, you don't need that. You just need to take $9,000 worth of supplements and pay $1,000 an hour to see someone who has no training in endocrinology. Okay. Or that it's a spiritual thing, or it's a nutrient deficiency. Y'all, we are born with all of our egg supply. Okay. Actually, our maximum egg supply is when your mother was 5 months pregnant with you. Okay. That's when you had the maximum amount of eggs, and they start dying off in utero. Okay. By the time we're 30, we are down to 10% of our egg supply. And by the time we're 40, we're down to 3%. Our eggs, we're born with all of our eggs, and they die off, and they become, which is why we see some more chromosomal abnormalities as the mother's age gets older, okay? Because they don't respond as well. They age much faster than the rest of our body, okay? Our eggs, let me say it again, our eggs age twice as fast as the rest of our body. And we lose them and have to live a third to a half of our lives without the benefit of the estrogen, progesterone, and some testosterone that was produced. And it changes our life forever. Okay. So, all right. So please go to my link in bio, take the menopause quiz. I have so many free resources for you guys. Okay. Yes, I made a book about nutrition and wellness in menopause. It's called The Galveston Diet. Go check it out. But that's not why I'm here. Okay. I'm here to answer your questions and make sure you can advocate for yourself. Tinnitus, ringing in your ears, absolutely a symptom of menopause. There are estrogen receptors in the inner ear. Okay. So we see vertigo and tinnitus, ringing in the ears. Absolutely. Two things associated. We don't need more gynecologists and endocrinologists. We need more education in our training programs around menopause. We need to have society and medical societies and the world recognize the value of a woman outside of her ability to reproduce. The lion's share. So women get shit on medically. I hope y'all know this, right? In medicine and healthcare and studies and pharmacology. And then when we look at funding for women's health, the lion's share goes to reproduction. The lion's share. Okay. I'm wondering about that. When you're post, do you still have a hormone imbalance? Guys, don't use the term hormone imbalance. Okay. There's no balance in our sex hormones in a woman. They fluctuate on a day-to-day basis until you're menopausal and then they plummet and go away completely. Okay. When we use the term balance, it's so inaccurate. It's just become this catchphrase for everyone on the internet to try to sell you their masterclass. Okay. I never use the term balancing hormones. They're not balanced in real life. Look at the hormone cycles. They peak at ovulation. Estrogen plummets after ovulation. Progesterone surges from the corpus luteum. That's not balanced. Balanced means a steady state every day. That doesn't happen for women. That is not how we are functioning. Okay. And people who are using the term what hormones? There are hundreds of hormones in your body. Hundreds. Which ones are you referring to? Insulin, glucagon, leptin, ghrelin. I mean, like these people don't know what they're talking about. And this vague term of hormone balancing is a way for them to sell you a masterclass or a supplement. Okay. That is not what I talk about here. I talk about evidence-based medical fact. That's what I represent here. And I just want to help you. Okay. All right, I'm answering questions. So when you're postmenopausal, your eggs have died. They're not died. They have shriveled into oblivion. They are obliterated, and there are no functioning cells left in your ovary to egg cells. And so the theca and the corpus luteum, none of that happens anymore. So we don't have any more estrogen produced in the ovary, no more progesterone produced in the ovary, no more testosterone produced in the ovary. It's over for the rest of your life. Okay, now the adrenal glands will still make some testosterone. You'll have peripheral conversion of some of the precursors to a little bit of estrone, which is very, very weak in the periphery, not enough to be clinically significant for most menopausal women. Okay. All right. So does intermittent fasting mess up hormones? Absolutely not. Multiple studies done on this. They've done multiple studies on premenopausal, perimenopausal, and menopausal women and checked hormone levels throughout the fat. Now, this is not extreme fasting. This is like the 16-8 daily intermittent fasting. No changes. None. Now, if you starve yourself, if you go into starvation, which is a different level for everyone, okay? If you go without calories for enough time that your body starts that's what starvation is. You cannibalize your muscle to provide amino acids, which are then broken down to provide fuel for your body and fat. Then that can, chronic starvation will suppress ovulation. Yes. Okay. We see women with anorexia. This happens all the time. Chronic athletes with that level of performance, suppressing ovulation, period, stop. Okay, yes, that can affect. But daily intermittent fasting, when done for anti-inflammatory purposes, no, it has never been shown when done healthily to suppress anything to do with your hormones. Okay, so don't take that masterclass. Don't buy that supplement. All right. Okay. Do women have this many problems in OB-GYN in the EU, or is it just an American thing? Hey, y'all, anybody out there in the EU, you're 8 hours ahead, so I know it's the middle of the day. Yes, this is just as bad everywhere else. I have women following me from all over the world, and it is a universal consensus, especially in the UK. We as a world are not, US leads the world in medical care, what used to. And so not anymore. And so for health outcomes, the EU does much better than us. People are much healthier in the EU. Sorry, it is what it is. because they focus on prevention and not just giving you a pill. You know, I think we need pharmaceutical options for a lot of things. I take pharmaceuticals, but yeah. Stopped period at 57.62. Yes, of course you can be on HRT. It is an individual decision. Listen, the decision to start or stop hormone replacement therapy is here's it. I'll give you the secret. You ready? When the benefits outweigh the risks for you. That's it. It's that simple. You stay on hormone therapy. You start and stay on hormone therapy as long as for you alone, your individual medical risk factors. And if your healthcare provider is not taking the time to suss those out with you, you need to find somebody else. Okay. As long as the benefits outweigh the risks for you. Age does affect that. Okay. But you're only 5 years in your menopause journey. If you don't have so I would absolutely consider it after a discussion of your risk factors. It would be an option. Okay. I'm reading your questions. Hang on. 500 people. Keep liking, keep following, keep sharing. Please, please, please follow me. Please keep tapping my face as many times as you can stand like that. Thank you for all you do. You're so welcome. Please help with constant vertigo. Okay. So if your vertigo is new to your menopause, this could absolutely be an association, and you need to consider hormone therapy as one of the ways. Not to say you don't have to do the other things, but there is a definite, Vita shared the live. Share this live. Share it. This makes it really drive the algorithm. Why is my thing not charging? Hang on, y'all. I'm on the struggle bus here. Oh, there it goes. Okay. Yes, I'm in my pajamas. I need more coffee. I have to get up and go make some coffee. What age is too late to start HRT? There is no age at which it is too late to start HRT. When the risks outweigh the benefits for you, it's too late. That's it. How long are you on it? When the risks outweigh the benefits, that's when you stop. The end. Can you have a postmenopausal surge of estrogen? Not without a tumor. Okay. Once your ovaries die, they die. That's it. Once you're completely postmenopausal, there is no more production of estrogen from the ovaries unless you have a tumor. That is it. You are done. Can a smoker do hormone replacement therapy? I really wish you wouldn't smoke. I mean, that is the biggest risk to your health overall. And so if you're looking to get healthier, when you look at the risks and benefits of hormone replacement therapy. So if you're still smoking, I don't know a physician who would give you hormone replacement therapy, but it would be a patch. You would never want to do oral ever, 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 because the risk of stroke with smoking is so high as you become postmenopausal. I mean, if you really understood what this was doing to your body, if you smoked, I would really have a hard time recommending this to you, because we're doing hormone replacement therapy for your long-term health. And I'm so sorry. I mean, it's just stopping smoking is going to be the biggest impact on your health. So I would immediately launch into ways that I could help you and help facilitate that. I was former smoker here. I get it. I was absolutely addicted to nicotine. I absolutely get it. I started smoking in high school with all my girlfriends. My parents smoked. I came up in a smoking household. I, was a pack-a-day smoker at 22, full pack. Okay. I get it. Okay. Y'all have no idea how I was brought up. It would freak you out. I started, my first cigarette was at 9. I stole it from my daddy and we went in the woods with all my friends and smoked it. So I get it. Menopause has nothing to do with vertigo. Yes, it does. Oh my God. Hi, you must be a chiropractor. Nice to meet you. Or one who steps outside of there. I'd go to a chiropractor and I fucking love her and she's amazing. But don't come on my page and tell me as a world-renowned menopause expert what menopause is or is not related to. But I always come with receipts. Let's go get my laptop. Menopause has lots to do with vertigo. Hang on. We're going out. Of course, it's user 555999999. They don't even have a name. They're just, okay, so let's go to my laptop. Hey, babe, do you have my little stand for the phone? The little flippy thing? Okay. All right. Okay. So throw out some other symptoms you're curious about that might be related to menopause, and I will give you the receipts. Oh, thank you for the heart crown. Sorry, babe. Now I'm going to have to talk in front of my husband. I'm putting the phone down so I can set up my little stand. Okay. All right. So who out there has suffered from vertigo? Unexplained. Go to the doctor. They do all the tests. They cannot figure out a reason why. Just idiopathic. But they never mention menopause. Does that happen to anyone? And thank you for the likes. Okay. So I am gonna, let's see. Oh, it won't let me turn it around. Oh, flip camera. Okay, here we go. Y'all are going to be looking with me. So this is that's my book. So look at all these. I'm researching for the new book I'm writing. Dry eye syndrome in menopause. Anybody have that? I was just doing that chapter. And hormone replacement therapy for dry eye disease, systematic review, and meta-analysis, okay? Estrogen signaling impacts temporomandibular joint and periodontal disease pathology, TMJ, and menopause. Who knew? Anybody having that? Let's see. Now, if you don't believe in research, then this is the wrong page, okay? Comparison of temporomandibular disorders between menopausal and non-menopausal women. There's another one. What was this one? Oh, this is a good one. Menopause acne. Anybody have that? I was researching that for the book. Okay, so what I do is say this, and y'all can all do this at home. Let's do vertigo. And, I've already looked this up. Look, it popped up on my viewer. Scholarly. These was where the medical articles come out, okay? The actual peer-reviewed medical journal. Benign paroxysmal, this is vertigo, increases with age, especially during menopause, and a ratio of 2 to 3.2 for women and men aged 40 to 60 years. In particular, hormonal changes, external estrogens, and pregnancy exposure are only experienced by women. What? Here's the actual article. Vertigo and risk factors unique to perimenopausal women. So there you go. Okay. Joint pain. All right. So I'm going to give you guys a sneak peek. The book stuff is here. Here's multiple other articles. So here's stuff that's going to blow your mind. Okay. Menopause acne. We already talked about. The review of anti-androgenic risk of saw palmetto. So I do a lot of research on different supplements that might be helpful for different conditions that kind of pop off in menopause. And saw palmetto is an anti-androgen, meaning it decreases the activity of testosterone or dihydrotestosterone, which is where acne comes from in the skin. And so those of you who are anybody having odor changes? So I was researching that, and then, this lady sent me this article she wrote. Okay. Musculoskeletal pain during the menopause transition. Somebody asked about joint pain. This was written in 2020. This is absolutely a phenomenal article. So MSP, in conclusion, the perimenopause is a state during which many women are particularly predisposed to develop musculoskeletal pain. As to moderate degree, the odds increase linearly from age, from pre to peri, then post. Meaning it starts in perimenopause, but it gets worse as our estrogen levels decline. So, okay. I'm going to flip this guy back around. Hang on, it takes me a second to flip all this out. Okay, so let's keep answering your questions. Can HRT help you to lose weight? Okay, so when we talk about weight, I think what most of you are talking about is fat, right? So you have to learn at our age to let go of the number on the scale. It's so important because forever we've been tied to it. My own, we're gonna make some coffee while we do this. So we have our body, our weight is made up of several things. It's made up of water, it's made up of muscle, it's made up of fat, okay? So HRT really doesn't seem to affect the number on the scale that much hormone replacement therapy. It's not a miracle to make the number on the scale go down, but here's what it does do. What we see in menopause is a body composition change, loss of muscle and gain of new fat deposits, especially visceral fat, which is the dangerous fat. I don't care if you have bigger boobs and a bigger ass, okay? That's not unhealthy. That's just curves. And we need to embrace that, okay? What's happening that makes it dangerous and risky to our health is the increase in intra-abdominal fat or visceral fat, because that fat is inflammatory and and it increases your risk of cardiovascular disease and stroke and dementia, diabetes, and cancer. Okay, those are things that we don't want, right? So here's what HRT does. It decreases the shunting of fat to the viscera. So it decreases the accumulation of unhealthy fat. Women don't go on HRT and the scale magically goes down, but they get healthier. Okay, so what do you want? Now, hang on, I'm cleaning out my little coffee thing. All right, we're making coffee. So, and if you have a Keurig and you don't have these reusable Keurig cups, I'm about to rock your world. So I get them from, or you can get them anywhere, but because anyway, sorry, I hate supporting Jeff Bezos more than I have to, because I wish he would, I just wish he'd keep marrying women that take all his money and devote it and give it to charity instead of flying rockets. Okay, so these reusable Keurig cups are here, and so I just take my own coffee, which I have in a little container, and it saves so much money, and there's no waste from the Keurig cups. So, but I love Keurig because I love making your first cup of coffee, just one, right? So I just fill my little cup with my coffee, put the top on. You got to press it down real hard. And then I pop it into my Keurig and I make coffee. So it's brewing. All right. Nespresso. I don't love the Nespresso. They have one. So we have, I don't love Nespresso. I'm just going to say it. It's okay. It's not my favorite. Yeah. So if you have a Keurig and you love it, but you're getting a little itchy about the cost of the Keurig cups and the waste, this is an excellent way. So you want the plastic one with the metal mesh or all metal. And then you just use your own coffee and fill it up, and it's so much more economical and there's no waste. Okay, vertigo, TMJ. Yes, I just showed the articles on that. Vertigo and TMJ are both absolutely associated with estrogen deprivation. So, okay, fatigue. I have a great statistics on fatigue. Let's look at it. So I'm going to give you guys a sneak peek into, okay. So my new book is coming out. It's called The New Menopause. And the last section of the book is a symptom guide where it's symptom by symptom. So I'm going to give you guys just here on this live right here. So everybody click. I'm so excited to show you. Okay. This is where I've been here in Colorado writing and researching all summer for this new book. All right. So hold tight. I'm going to flip the camera around and I'm going to give you a sneak peek of the book. Okay. So this is a Google Doc for me, in this section right now is 128 pages long. Okay. So when you get to, line this up. All right. This is kind of an explanation of what the menopause toolkit is. Do you see all these symptoms? Okay. They're checked off for the ones that I've done the research. I've done them all. Okay. This part is done, but I want to just show you asthma, anxiety disorder, arthritis, bloating and digestive changes, body composition changes, belly fat, body odor, brain fog, breast soreness, brittle nails, burning mouth or tongue, changes in your taste, decreased desire for sex, dental caries or cavities, depression, difficulty concentrating, disrupted sleep, dizzy spells, dry eyes, dry mouth, dry skin, electric shock sensations, fatigue, frozen shoulder, headaches, hot flashes, high cholesterol, high triglycerides, irregular heartbeat, insulin resistance, irritability, itchiness, joint pain, loss of muscle mass, memory, mood changes, muscle tension and aches, menstrual cycle changes, too heavy, too light, too short, too long, new hair growth or whiskers, night sweats, osteoporosis, palpitations, reflux. Where's hair loss? Oh my God. Night sweats, osteoporosis, palpitations, reflux, recurrent urinary tract infection, stress, incontinence, thinning hair. There it is. Thinning skin, unwanted hair. Oh, that's a double because okay, I got to fix that. Tingling sensations, tinnitus, TMJ, vaginal dryness, pain with intercourse, vertigo, weight gain, wrinkles, skin, collagen loss. Okay, so those are the symptoms that I am discussing in the book. Which one of those would you like me to give you a little sneak peek on what we found? So reflux, absolutely. What does it not cause? Every organ system in your body has, so let's take the first one, which is menstrual changes. We all know that one. That one's easy. Okay, let's do palpitations. Hot flashes. Wait, where's my palpitations one? Abnormal uterine bleeding. Latest research. Okay. Give me a second. We're going to find palpitations. There it is. Okay. So irregular heartbeat, palpitations. Insulin resistance. I'll talk about pellets in a minute. So I had hundreds of women submit their menopause stories and all their symptoms and kind of what their journey has been. So each symptom is going to start off with someone's story of her menopause journey. And this one was, she had a lot of palpitations. So heart palpitations so this is all the research, and I have all the research articles linked here. And I've done summaries of each of these research articles. So like palpitations, 42 to 54% of peri and postmenopausal women with up to 40. Yeah. So this is half of us will have palpitations, half. So if you are a sufferer of palpitations and had a whole cardiac workup and everything was normal, let me know. Let me see it in the comments. So, okay. So then I go through, yes, validating this is happening to you and you're not crazy. And I talk about how estrogen is related to it and then what you can do about it. So for each one. Okay. Let's see. So yes, you get palpitations. I see it. Okay. You're 53 and still no perimenopause. How late can it start? Well, 55 is kind of high normal. So you still have a couple of years before we would expect your periods to stop, but it is going to happen. But you have to remember that the longer you have natural estrogen on board, the healthier you are. I know it's a pain in the ass to have periods when none of your friends are, especially if they're driving you crazy, but your risk of cardiovascular disease, Alzheimer's, dementia is much, 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 much lower, much lower. So TMJ, absolutely. Yes. A connection. Fatigue. Okay. That's why we started all this. Let me go find fatigue. What percent of premenopausal, perimenopausal and postmenopausal women do you think complain of fatigue? Like exhaustion, like absolute exhaustion, not just like I'm tired, but like life-changing fatigue. What percentage do you think would, I'm pulling up the fatigue section. Oh, here it is. Okay. Let me see. 80, 75, 90, 99. Okay. Y'all are close. All right. So here we go. This is research documented. Okay. I didn't make up these numbers. All right. Flip camera. There we go. So I had to look up, we have so many symptoms. I have to go look them up to find them in the journal. Okay. So this is the section on fatigue. Of symptoms experienced by women over the course of the transition. Fatigue is clinically significant because it may be disabling. It's one of the most common and distressing symptoms associated with menopause. In a cross-sectional study of 300 women, 85.3% of postmenopausal women, 46.5% of perimenopausal women reported symptoms of fatigue compared to just 19.7% of premenopausal women. Yeah. Okay. So it is more common to have fatigue than it is, here's the numbers here, okay, than it is to have hot flashes. So less restful sleep. So we talk about other causes, authors, society, stress and tiredness. I think this is just bullshit, okay? Everyone launches into, well, this is a really hard time for women. You know, so many of these articles that I read especially when it's done with things that are mental or considered maybe to be mental and psychological. They're like, well, it's a really hard time for women. I'm like, look, my stress is no different than it was when I was 35. I mean, it's a little different, maybe less, but to just categorically start dismissing women that your life is hard. Our lives are fucking hard. All of our lives. Okay. Like, we're women. We get it's just hard. Okay. But I was okay. I was managing my stress. What happened in menopause was I lost some resilience. Okay. Menopause took away my resilience. Don't talk about that. Oh, I have aging parents and empty nest syndrome and all this shit. Yes, everybody's going through that. Okay. We all have our shit. Okay. But I was managing my shit. I was managing. I was okay. All right. I had good days and bad days, but I was okay. And then menopause and perimenopause took away my resilience. Not that my mom and dad got old. I knew that was coming. Not that I lost 2 brothers and my father in the last 5 years. Okay. I was managing. I had that down. And so I get so mad in these articles when they have to throw in, well, it's hard for women at this age. I'm like, life is hard. Life is hard. I was okay. I was not suffering like this at 35. Okay. So I digress. All right. So if you don't follow me, please follow me. I do lots of education here on the platform. All right. I gave you back your life. I forgot the Himalayan sea salt in my coffee. I'm using very high quality flavored coffee, so I don't need the sea salt, but I do like a little pinch. If I find it bitter, I'll put a little bit in there. Okay. Night sweats, body tingling sporadically. Metformin used to help with insulin resistance during menopause. Thoughts? That study hasn't been done. Studies. We need those studies. I don't know. I would just be giving you my opinion. And I don't like to do that. I like to give you stuff based on fact. That might make me a little bit different from some of these internet practitioners. So, how do you know if you're in perimenopause? Go take my quiz. There's no blood, urine, or saliva test. Save your money. Do not spend the $400 and $500 to have the Dutch test done. Don't do it. It's worthless. Okay. None of that shit's been validated. Oh, thank you. None of that stuff has been validated. None of it. Save your money. Okay. To diagnose perimenopause, all you have to do is listen to the patient and believe her. That's it. My life's different. Something has changed. I can't put my finger on it. I'm not sleeping well. I'm having joint pains. Whatever your litany of those 60 symptoms are. Okay. Let's start talking about treatment. That's all. That's all you have to do. You don't need to spend $1 million. You don't need to go. Okay. Yes, we have a referral list on our websites for menopause-friendly practitioners. I haven't vetted them. These are people who y'all wrote about, who you loved. Okay. Also, the North American Menopause Society has a list on their website as well. If you go to my website, galvestondiet.com, go to the link in bio. So go to our webpage and scroll all the way to the bottom. There's a big list of shit down there. Okay. And one of them is physician referrals. And if you have a great menopause provider, those of you who've got out there and fought the good fight, please give us a recommendation so we can share it with the world. Okay. There are some Canadian doctors there. There's some from out of the country as well. So also, if you think you might be perimenopausal and you want to there is a validated scoring system it's on the link in bio at the top. It's called the Perimenopause Quiz. Go take it. And then put in your email at the end. It's going to give you a shit ton of information. It's going to take you to blogs. It's going to teach you how to advocate for yourself. Okay. My advice for NAMS helped you find a great doctor in Canada. That is awesome. It's menopause.org is the North American Menopause Society, or you can go to our website at galvestondiet.com. So shameless plug here. Did anybody see me on the cover of Women's World? Okay. That is the most Photoshopped picture. It is me. Same glasses. That's me. Please ignore the title. I had no editorial, jurisdiction over this. It made me crazy. This is actually one of my patients. She has lost 90 something pounds. Her insulin resistance, her cholesterol, her blood pressure, she is so much healthier. And this woman is killing it. She's working out like a boss. She's so strong. I just love her. Anyway, so this was at, I know it's a salacious grocery store magazine, but I did all the stuff in the inside. There's me again with my little white coat. Hello. There's Rhonda, who lost 90 pounds with the Galveston diet. She's also a patient. So this whole article, I did actually get to have editorial stuff on. So the stuff inside is good. And then here's my book, Galveston Diet. It's on sale on Amazon. Again, Jeff Bezos can go to hell, but it is cheap. It's like $19. So, let's see. So go check this out. Go buy the book. The new book, the new Menopause is the new book. It's coming out next year where I'm going through. But so Galveston Diet is like a nutrition, wellness, and like a hormone primer. So it's got recipes, meal plans, all kind of stuff there for you. You know, we basically did it for the visceral fat, you know, body composition changes, but y'all wanted more. You wanted more information. You wanted more information on hormone replacement therapy. And I do a deep dive into all of that in the new book. So, does Amberen help? Not really. Not against placebo. So, okay. So everybody take a break. Give me your finger and tap my face 50 times like that. That will drive the algorithm and give me likes. It will also, if you don't follow me, and you can share this video with someone down here, you click the share button, and then you please follow me if you don't. The new book will be out in May. So May, we're turning in the the manuscript next month in October, and it takes a while to get everything going. You will be able to pre-order probably in November or so. So you don't need blood work for HRT. I do a lot of blood work on my patients, but very rarely do I do hormones. It's not helpful. I know she's menopausal because I listen to her and I believe her. A menopausal woman comes in waving a flag. You know, it's so easy to diagnose menopause for most. Now, if she's had hysterectomy or she has a Mirena IUD and I can't use her periods to help guide my decision, I might check to see if she's postmenopausal. Perimenopausal never needs blood work, almost never. And so now I am checking nutritional deficiencies. I'm ruling out autoimmune disorders. I'm looking for anemia. I'm checking for inflammation markers. Like I'm getting blood work, yes. And, but I'm not usually doing hormone levels because I can diagnose perimenopause by talking to my patient and believing her. But there is a quiz on my website it's a validated scoring system. It's called the Perimenopause Quiz. It is at the link in bio and you can check it out. Joint pain. So turmeric. So I do, full disclosure, I have a few supplements that we sell. We make fiber, we make a collagen, we make a vitamin D omega-3 with K, and which is sold out right now. We're having some, God bless us, we're growing so quickly. We're struggling to get supply in. And, in those of you in Chile, there's what is it, honey? So we use fish oil, right? Which is where most omega-3 comes from. It's the greatest, high quality. But Chile and Peru are having troubles with their fishing industry. And so we're having a hard time sourcing omega-3. So get ready. The prices are going to go up for all of you guys who are taking omega-3, which I highly recommend. If you're not eating salmon at least 3 to 4 times a week or some kind of fatty fish. So the book is available on Audible, yes, and ebooks. So yes, all that. Anywhere you buy books, you can find them, but Amazon does have it on sale right now. So do you ever spot postmenopause? Any postmenopausal bleeding, must be evaluated by your gynecologist as soon as possible because it is cancer until proven otherwise. I don't want to be an alarmist or try to scare you. It's probably not cancer, but that is your uterus, your vagina waving a red flag. Something's not right. You should never bleed in postmenopause. So every woman with postmenopausal bleeding should go to her doctor immediately. Do not blow it up, blow it off. It's not a period. Your ovaries have not come back to life. It is absolutely, okay, so y'all wanted me to talk about pellets. Okay, so I have a huge section on this. So when we talk about hormones, remember there are hundreds in our body, hundreds. Insulin's a hormone, vitamin D is a hormone, leptin, ghrelin, We have the pituitary, the hypothalamus, GnRH, prolactin is a hormone. So, but when y'all are talking about, in gynecology, it's usually sex hormones that we're talking about for all people. So we're talking about estrogen, progesterone, and testosterone, and all people, regardless of gender, have all three in their body in varying rates. Females tend to have higher levels of estrogen and progesterone, lower levels of testosterone than males who have higher testosterone, much lower estrogen and progesterone, but we all have all three. Okay? Make that clear. And any man who tells you I had estrogen, he doesn't know anything about endocrinology, and God bless him. So, okay. So, now, where's all this made? So let's talk about females, because that's what I do. I'm a female doctor, okay? Taking care of females. So when we have normal reproductive cycles, okay, pre-menopause, menopause is not a thing, our eggs, our ovaries, which store our eggs, okay, start every month, shoot an egg out in the process of ovulation. And that process is meant for you to get pregnant, okay? And if a pregnancy doesn't happen because there was no sperm, because there was a condom, or there was no sex, or there was, no sperm available because of it was blocked for some reason, or just not there, then you ovulate. The ovary now makes a corpus luteum where the egg spit out of that little hole, and you pump out progesterone for a couple weeks, and then the corpus luteum dies, and the whole thing starts all over again. Okay. So the ovaries create estradiol. Okay. So that is our natural innate hormone. There's several estrogens in the body, actually. There's three main ones. So there's estradiol, which comes from the ovaries. There's a little bit created from the peripheral conversion in the tissues, from precursors, but very little. Okay. It's not enough to be that clinically significant. Most of it's coming from the ovaries, the vast majority, 98% or so. I don't know. So, and then progesterone, we really only have the second half of our cycle. We get the surge of it, right? And then testosterone is created 25% in the ovaries, 25% in the adrenal glands, and 50% from peripheral conversion. So we get a lot in the fat cells that are aromatized through an enzymatic process. Okay, so when we go through menopause, we lose estradiol. It goes away. That was the water you were drinking. The other estrogens in the body are estrone and estriol. There's a few others, but they're so small they really don't matter. Okay. So estriol is what is created in the placenta in pregnancy. Okay. Estrone is what's created in the fat tissues. Estriol and estrone are much, much weaker than estradiol. They're not as active. They don't act as strongly as estradiol does. The more fat you have anywhere, the more estrone you're going to have, which is why women who are obese have more cycle problems, have more endometrial hyperplasia, and probably have a little bit more breast cancer. That's part of it. So, estriol is only there when you're pregnant. You don't make it any other time. Okay. And we make a shit ton of estriol, which is, it's weaker, but we have a lot of it. So it has a high level of activity because we have so much of it. Okay. While we're pregnant. Pregnancy goes away, everything plummets. So when we go through menopause, we stop making estradiol. Now we're talking about hormone replacement therapy. Okay. We're getting to pellets, I promise. And hormone replacement therapy, we're giving you back some estrogens. Now we have a lot of pharmaceutical options, pharmacological options, okay? Lots. We do have estradiol, which is the closest thing. That's the water you were drinking. That's pretty much what I prescribe, okay? I stick to that as much as possible, all right? It is body identical, but that's gotten way whacked out term. Like, I don't love using it because it means different things to different people, and there's somebody out there talking about bioidenticals who's trying to sell you a masterclass, okay? Okay. You just need a gynecologist who knows what they're doing. So let's just stick to talking about estrogen right now when we're talking about pellets. Bye. Love you. So now I've got this molecule of an estrogen that I want to put in your body. How do I get it in your body? Okay. That's a delivery system. So we have formulations, which is what type of estrogen am I giving you? Okay. Which might be ethinyl estradiol, or there's a bunch of chemical names I'm not going to list because they make my head hurt. But, I've got estrogens I want to put in your body, in some kind of formulation. And then there's a delivery system. Okay. So we have oral and non-oral. Boom. Pills and capsules are oral. Okay. Swallow. Boom. Goes through the liver for processing. Not my favorite way to give estrogen. Why? Yes, it's cheap. It's so convenient. It's easy. We love taking pills. It's easy. Okay. There's a first pass effect to the liver. And it can make your clotting factors go up. So the highest risk of you ever having a blood clot is with oral estrogen. I can take that increased risk away by giving you a non-oral formulation. All right. So non-oral formulation is pills, patch, cream, ring, pellet. Okay. Multiple options. Estradiol is available, which is body identical in all of those options. Those of you who are being told that pellets are the best, they're the safest, they're the only thing you should get, they're going to give you that's a lie. You have multiple options. Pellets are the best for the person putting it in your body because it's making them the most money. The end. Okay? I have an ethical problem with someone and if you and your healthcare provider go through every option in the book and y'all decide between the two of you that this is the best option for you, go for it. It's your money. You get to spend it any way you want. And I have no place to say. Okay. Yes, you'll feel it is menopause hormone therapy. Yes, it works. However, it's the most expensive option. It is the most expensive option, and it's making your healthcare provider who's putting that in your body the most amount of money. I don't ever want to have an ethical dilemma in my heart that I'm driving someone to an option that I'm going to be able to buy a Porsche. Okay. You have cheaper options. So for my patients, I prescribe a regulated form because I don't love the FDA. I don't think they're perfect. I think kind of they're shitty sometimes. But I know that 98% of what they say is in that patch or that cream or that gel or whatever I'm prescribing from something that's formulated. It's in there because they have to be tested. Compounding pharmacies, including pellets, do not undergo the same rigorous testing that FDA-approved options do. I'm going for safety. I'm also going for cost. Patches are generic, well tolerated by most people, not all, okay? Sometimes the glue, the adhesive doesn't stick very well or it causes a reaction. We got to do something different, all right? I'm going for safety and I'm going for what my patient can afford. I don't think that the wealthy should be the only ones who can afford hormone therapy. I think that's fucking ridiculous because all women need the water that they were drinking to stay as healthy as possible. And I'm going to choose an option for you that is the most affordable for you. Now, if you want to drive the expensive pellet Mercedes, fine. You want to spend $400 a month? I got a woman down the hall who'll do it for you. Okay. But for my patients, I can give them safe, efficacious hormone therapy that works, that they don't have to choose between a dinner out with their family or if they're going to get their pellets. Okay. I don't think hormone therapy is for the wealthy. I think it's for everyone. And you get to pick and choose what you want. Okay. So, let's talk about testosterone. There's one particular company that's very, very, very popular. It's making doctors very rich. And it's $1 billion company. And it's called BioT. Okay. In BioT's prescribing instructions to the healthcare providers, they are recommending super physiologic doses of testosterone for women, and they do not have one study, a gold standard randomized controlled study, to justify super physiologic dosing in a woman. Google this right now. Take out your phone, Google normal testosterone levels in a woman. And I'll tell you right now, the high normal is 70, 55 is average. This is at 25 when you were knocking the back out of your boyfriend. When your sex drive was as high as possible, your testosterone level was an average of 55. 55, okay? What they are recommending in their literature, because I've seen it, is a therapeutic range with no evidence of 150 to 250. 3 to 5 times the physiologic dose. The higher your testosterone level, the higher your level of complications and severe side effects are. Okay? They have no data to support this. No safety data, no randomized control studies. Why are they overdosing these women in pellets? Because they didn't want to make a smaller dose. They took the men's pellets, which they'd been doing for years, and just threw them in a woman and said, on the lowest dose, and said, you're fine. They won't make them lower. It's going to cost them too much money, even though they're making billions of dollars. So they don't have your best interests at heart. They're not reinvesting the billions of dollars that they're making in this into women's healthcare, into menopausal healthcare. They are transitioning you from a female to a male. Male levels, a normal male level is somewhere around 236 is low male levels. Low, okay? I've seen women coming to my office, coming off of pellets. They've had the pellets in for months, and I'm checking their testosterone level to see where they're at, to see if I need to start supplementing, because I do give testosterone, okay? I do it in physiologic doses, which is what all of the medical societies recommend, by the way, okay? People who care about your health and your well-being and not about just making money never recommend super physiologic dosing. And they, months in, are at 3 and 4 and 500. Those of you who have been given pellets, how high did your testosterone levels get? Did your doctor say fine? Did he talk to you about being super physiologic? What kind of side effects were you having? Oily skin, acne, temporal balding, clitoromegaly? Yeah, your libido might have been higher, but I mean, my God, you've turned you into a teenage boy. Is that what you want? If that's what you want and you don't care if it's super physiologic and you're going to live with the side effects, go for it. Go for it. Okay. So, that's how I feel about pellets. They're being abused and, they're not being honest with you, and no one's discussing super physiologic dosing. If you understand the risks and you're like, fuck it, I want it, go for it. But did they tell you that that's not a normal range for a woman, that your level would have never gotten that high at your most sexually active? The most, I don't even say sexually, the most your libido ever was? So, oh, Care Bear, God bless you. Estrogen increases your risk for a blood clot. Only oral. Only oral. Transdermal, non-oral forms, creams, pills, patches, rings, even the pellet, does not increase your baseline risk of, actually, the patch has been shown to decrease your inflammatory markers versus oral. So you know not of what you speak. You're just repeating what you've heard. Unless you've done the research, do not come on my page and give advice. Do not. I will take you down every time. Non-oral forms of estrogen do not increase your clotting factor risk over your baseline. If you're a year out from your pulmonary embolus or your blood clot, if you have a family history, if you have MTHFR, which really isn't that high of a risk, or if you have whatever, protein C, protein S, you can do transdermal estrogen safely without increasing your baseline risk of clotting factor. The end. Okay? Is HRT safe after cancer? No association with Merkel cell carcinoma. Absolutely. Absolutely. After treatment for endometrial cancer, for ovarian cancer, for uterine cancer, and for breast cancer, you still might be a candidate for hormone replacement therapy. Again, as long as for you, the benefits outweigh the risks. And you need a doctor who knows what they're doing. Let's see. Does the transdermal patch have testosterone? So it depends. You have to look on the labels. There is the combi patch, and there's one more that has progesterone in it. But oral micronized progesterone, progesterone is bioidentical, the word progesterone, okay? And so so when progesterone was first formulated in the 1950s, it had very poor oral absorption. Because the molecule is so big, which is why transdermal cream of progesterone, those of you who've been given a cream, it doesn't work. It doesn't absorb in the skin very well. You don't get enough. You're at risk for endometrial hyperplasia and cancer. They don't know what they're doing. Okay. If they're prescribing you progesterone cream and you're given estrogen and you have a uterus, you're at risk for cancer. Don't do it. So then they figured out Prometrium figured out how to micronize the progesterone, make it small. So it has great oral absorption. This is the safest progestin. Okay, this progestogen. So when we talk about progesterone options, we have progestogens, which is the big umbrella of all progestogens. Okay. Progestin is synthetic. Progesterone is the natural, is the bio, the one most like what your ovaries make. All right. When they've done studies looking at both breast cancer, blood clots, and hypertension and cardiovascular disease, oral micronized progesterone has the highest safety profile, the less risk of those diseases associated with its use. That is why I prescribe it almost uniformly, and almost everybody can tolerate it. Now, if you can't tolerate progesterone, there's a few of you because it's usually an oil and some people have a reaction to the peanut oil and whatever, then we're looking at things like Duo-V, and we have to go or maybe do some more compounding. But let's see. Elevated inflammation markers, frozen shoulder for over a year. How do you lower it? So inflammation markers being elevated, how do we lower it? It's hard to know sometimes what's causing the increase but here's what we know. An anti-inflammatory diet absolutely lowers it. Fiber or diet rich in fiber absolutely lowers it. Turmeric can lower it. Estrogen hormone replacement therapy based can lower it. Oh shoot, give me a second. Omega-3 fatty acids, can lower it. Diets rich in anthocyanins, which is an anti-inflammatory diet. So leafy greens, fruits, vegetables, and nuts, seeds, absolutely. Diets rich in that can lower it. Avoiding like more than 25 grams of added sugar per day. Okay. Not to say you can never have sugar, but limiting it to 25. Women who do that consistently in menopause have a lower inflammation panel than they do. Things that will lower your insulin levels. Fiber. I mean, it's all vitamin D. Oh my God. Deficiency in vitamin D is a huge cause of inflammation. So making sure you're getting adequate amounts of vitamin D every day are all of these things that can help. Your pajamas. Thank you. So Emily's on the island in Galveston is like my go-to. It's the cutest little shop and I love everything there. And they're online. You can find them on Instagram. So Emily's on the island. They have a boutique. She also does like decorating. Like those of you who love my office with the fancy wallpaper, that was Emily. Let's see. Okay. Do not do oral testosterone. Don't do it. There's better ways to put testosterone in your body. If your hypertension is well controlled, you need to be on a to increase your blood pressure. It actually can be helpful. So how can you lower your LDL naturally? Exercise and fiber, a diet rich in fiber. Okay. Is the best way. So, okay. So I'm going to jump off. I need to get down to the gym and do my resistance training. Eva Mist is a topical spray. That is another option. Yes. I've never prescribed it though. It's expensive and it just seems like it would miss your skin. I don't know. I think of a spray like perfume. And there's no generic. It's expensive and I can give my patients good, high quality, most of them a tolerable in a generic form. That's great that they can actually afford. I don't want you to have to choose between hormone replacement therapy and your life, so I try to keep the cost as low as possible for you, for my patients. Okay. She's informative, but y'all realize some of y'all get so mean to me, so fucking mean because I don't answer your comments. Do you know how many DMs I get? I get thousands a day, thousands. I'm sorry. I'm doing my best. I'm just one person and I'm sorry you get your feelings hurt. I'm not sorry you get your feelings hurt. I'm just one person. Okay. And I can only read so fast and my eyes are blind without these. And so, I do my best, but this is the best I could do. So, that's all I can say. So horrible. Okay. All right. So please, everybody on your way out, I gotta go. I gotta go get ready for the gym. Tap my face a bunch of times. Follow me on Instagram as well as here on TikTok. Share this video with someone you think it would be. And then please follow me, give me a bunch of likes on your way out. Keep tapping. And we will chat again soon.